Hello everyone, good morning, good afternoon, good evening depending on your location. Welcome to my YouTube channel. Please, if you're new watching this video, kindly subscribe and press the notification bell for you to be alert of any new video I will post. Today we are going to talk about a mental health disorder called anxiety. Anxiety is a common word usually used, and today we are going to discuss in detail of really what anxiety is. We define anxiety as an unpleasant state of mind. It can be worry, it can be fear, which can lead to an unreal or an imaginary danger in its perceiveness or anticipation. So we define anxiety. Let me take it over. Anxiety is defined as an unpleasant state of mind. It can be worries, it can be fear that can lead to an unreal or imaginary danger perceiveness or anticipation. Anxiety is a normal situation that can happen to our day-to-day situation, because as human beings we have fears, we have worries, but when it becomes frequent, it becomes a problem, it becomes a mental disorder. So some of the symptoms of anxiety: we have nervousness. That is when there's lack of that peace, when there's the lack of that comfort, we have nervousness that can be visible, we can be experiencing. We also have a lack of concentration. When you're not at peace, always perceiving danger, you are not focused. We also have muscle tenderness. Our muscles are always tense. When you're afraid, when you're always in fear, there's also that ability of the muscle to become tense for you to be always at the defense, ready to be defend. There's also a rapid breathing, increase in your rate of breathing because you are not comfortable. We are always perceiving, you are not at peace with yourself. Increase in breathing, increase in heart rate. Your heart beats always like you are not in peace. Okay, so let's look at the causes of anxiety. What are those factors that can cause us to become anxious? What are those factors? We also have new job, changing of jobs. These are situations that some people face when you are used to a particular kind of job, a particular type of activity, in which you are now faced to change your job due to various reasons. The ability now to develop a new skill can be something that can make you to be anxious. That's something that can make us to be anxious. We have a change in living environment. Imagine yourself being used to living in an environment where you are free to eat, free to move, free to go and come back at any time, free to talk, and you will suddenly change your environment and reach to a situation where you have to ask for permission. You have to ask for permission before eating, before going out, before doing your normal, what you want. It becomes something anxious for you, because you'll be like, how can I be asking permission for everything? What if they refuse? What if they don't accept? It's so difficult. It can be difficult, This is one of the factors. We also have pregnancy. Girls, we know ourselves. Just imagine your menses lacking or missing for some days or a week. You start becoming anxious, nervous. How can I say tense? So I can say pregnancy can also lead to anxiety. Not only your menses, let's look at the fact that you're also pregnant. You know that you're pregnant. You're in secondary school. I'm pregnant. How will I inform my parents? It leads to anxiety. We also have birth process. Once you're already pregnant, already accepted the fact, or voluntary pregnancy. Let me imagine your first pregnancy. Imagine your first pregnancy. Going through the pregnancy, first experience. You also imagine the birth process, how it will be. You usually see some people shouting, crying during birth process. You ask yourself, you become anxious of how will be my own. You used to hear some babies tearing their mothers, tearing completely, undergoing sutures and all the like. You become anxious of how will be my own. We also have family or relationship problems. There are some kind of family situations situations faced in our families that can make us to become anxious, can make us to become anxious. We also have some verbal, we have sexual, we can even have physical abuse that can make us to become anxious. Imagine yourself, I would like taking this example of students being in school. Imagine yourself being abused verbally, being abused, how can I say, physical appearance, because there's some students in which there is a difference in physical appearance that can make one to become anxious because of verbal abuse or physical abuse from other students. It can even be a sexual abuse that can make you to become anxious. We also have some genetic factors. That is, as it is a genetic link from parents, children, grandchildren. We have genetic factors that can lead to anxiety. We also have some disorders like disease conditions. Imagine I recall during coronavirus issues, when COVID-19 started, it was mentioned that those who are having some kind of severe disease condition like hypertensive patients are more prone to have the virus than normal individuals. It makes some hypertensive patients to become so anxious, so tense, so confused, and so afraid to die that they become to refer themselves to their medical doctors, pharmacists, nurses to express their situations. So you can see that, or how can I give another example of cancer patients? You are just diagnosed of cancer. It becomes an anxious thing to imagine the pain that people goes through a cancer. And we also have the loss or the death of our dear ones. You can lose somebody, you can lose a dear one that can make you to become anxious over everybody, over everything you face. Remembrance, memories can make you to become very anxious. Let us look at the relationship between anxiety and sleep. Can anxiety cause lack of sleep? The answer is yes. Anxiety causes to a sleep disorder known as insomnia. We define insomnia as a condition or a repeated difficulties in sleep, even when you have the time and opportunity to sleep. You see, a repeated difficulties to initiate and maintain sleep, even when you have the time and the opportunities to sleep. That is insomnia. And insomnia, persistent insomnia, can aggravate or increase your level of anxiety. Imagine yourself being in fear, how can I say, persiveness, imagining danger throughout the day, throughout the night without sleep. It increases your level of anxiety, you see. So let's look at the tips of how to manage anxiety and insomnia. Let's look at the management of anxiety and insomnia. First of all, you need to develop a schedule time for your bedtime and your waking up time. You must have a fixed time that can help you to manage your anxiety and insomnia. We also have drugs. You have to check over your drugs because the side effects of some drugs is anxiety or even insomnia. There are some drugs that lead to anxiety that can even lead to insomnia. So you should check all these effects. You need to avoid other drugs abuse like cocaine, nicotine, alcohol. You need to avoid caffeine. We all know that it is commonly known that caffeine prevents sleep, right? It prevents you sleep. Now you should avoid eating some large meals immediately before going to bed. Please avoid eating large meals immediately before going to bed. That is one of the factors. You need to practice exercise, not at bedtime, of course, but practice exercise. This can help relax your muscles, give you a kind of positive spirit, and give you a peaceful sleep. So practice exercise, please. Always try to stop forcing yourself to sleep. Imagine you have a program, you had a long journey, a long day, it's a busy day, and you have another program in the evening which requires much energy. Then you come and force yourself, okay, let me sleep for 1 hour, wake up and go for a program. Don't force yourself to sleep if you are not sleepy. That is one of the reasons we have insomnia, sometimes anxiety. So thank you for watching. If you appreciated this video, kindly like my video and give on some comments to improve or encourage me in this. Thank you, everyone. Bye bye.